Senator Bennett.
Thank you, Mr. Chairman.
Colorado.
Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare
thank you.
in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world.
Why is that?
We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world.
Yep.
I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. These are, and we're, as I said, spending more than any other country in the world. And our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many things in the record, but I hope that you could answer these questions, yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you, yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH-published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that.
I'll take that as yes. I have to move on. I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that? I want all of our colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable,
they're turning the frogs
that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care.
Which is why we should be questioning all of the status quo.
It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Our healthcare is a disaster, but we should do everything that they're doing currently, not change anything. Don't ask questions like RFK does.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities.
Louisiana.
With this context, what will you do about dual eligibles?
About
dual eligible.
Dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
I'm not exactly sure because I'm not in there. It is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population, the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that said,
other options.
You've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, but also make it more cost efficient?
President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system.
So
rather than a service-based.
On Medicaid in particular, can you just take those kind of general principles and apply it to the Medicaid program?
I think that there are many options with telemedicine, with AI right now. And there's including direct primary care systems. We're seeing that movement go across the country. There's a One of the largest.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
I don't have a proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee-for-service.
Traditional Medicare,
Yes.
that's their choice right now. We have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. People can't afford it. It's much more expensive. Oh, in answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase the use of those, and to direct primary care. To continue to transition into a value-based program that is private. Americans by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis.
Democrat, Virginia.
And some imaginary new plan. And if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you.
Vote for more.
I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. The fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days? Funding and any kind of further work?
Slow the spread.
As Chairman Crapo.
Megyn Kelly's rolling her eyes.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up very, very important position.
As he pointed out, Senator, the portals that were closed were not closed as a result of the Trump.
Let me just tell you, I'd like you to explain, excuse me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down.
Yes, I know. It's
where
so
those
hard.
battered women
Yes, I know.
or a rural nonprofit I've got in the valley saying freeze is going to potentially shut down their ability to operate. I guess if you deny or don't know what your campaign's sending on, you don't know if you raise a lot of money Monday night.
I'm saying that the Trump administration.
You don't know if you raise a lot of money.
The Trump administration has made clear and it does not want to freeze benefits
All right,
for
just-
any Americans under Medicaid or Medicare, and I do not want to
There
dismantle
the
Medicaid.
freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly, you want to immediately get rid of 600 NIH workers on job one,
Yes.
on day one. When
Joe
we had our
Polish's
meeting,
podcast.
You said you'd actually like to get rid of 2,200 people from HHS.
Yes. Amazing.
Which offices
Start.
are you going to start cutting and riffing these 2,200 workers from?
The ones you like most.
Senator, there's 200 political appointees that are changed during every
So
administration.
if you got rid of those 200 political appointees, you're not going to replace them with your political appointees.
President Biden this year changed 3,000 employees at HHS.
Oh,
750
So
at NIH.
2,200, what departments are you going to pick them from?
The same as President Biden did when he changed 3,000 out.
Let me
Across all
I'm
the
down to a minute 30. The chairman's been generous with colleagues on both sides. I may have to go a couple minutes over, but let me just say, so let's just answer, this would be, this, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's
purge. It's a
illegal
transition,
offer to
just
try
like
to
Biden
buy
did.
out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety,
no,
work on trying to preventing things like salmonella?
no.
Senator, there's 91,000 employees.
So that, I take that as I take it. That's a simple yes. And I'm going to take that as
I
a
can
no.
run that.
I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals. Something we need to do a lot more on. Will you commit not to fire anyone in the health arena
No.
who currently works on protecting
I'm going
Americans
to run the
from
agency
cyber
how I
attacks
want to
in their
run it.
healthcare files?
I will commit to not firing anybody who's doing their job.
There we go.
Based on your opinion,
He's
based
gonna
upon
run
your
the
opinion,
agency.
or your political agenda, or Mr. Trump's political
What a
agenda.
dumb
Based
question.
upon my opinion.
Yes. I'm running
I
the,
guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits. Listen, any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president. He
So does that mean you're not going to freeze the funding that is currently frozen?
The White House
We're
has
done
made
freezing?
clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to healthcare that come from the federal government. They come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute by minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like,
no, you don't.
I don't feel
Laughing,
like
the crowd
you
laughing.
approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing.
You're going to run your own agency? You should.
Senator Langford.
Idiot.
Chairman, thank you. Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there.
Border boy
We've
from
talked about
Oklahoma.
pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about your views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very clear you're not going to tell Americans what to eat. but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life. And when life begins on that, you've been very outspoken on that. And we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This has been an area that has been interpreted for a long time. And President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that. And he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty healthcare, because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural healthcare. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, that he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, the first thing that occurs to me when you ask that question is, what patient would want somebody doing a surgery on them that believes that the surgery is against their conscience being forced to perform that? I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity, and we need to respect each other when we have different opinions, and not force our opinions on other people.
Yeah, thank you for that. The FDA under the Biden administration changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of, don't even go anymore to see a physician. But they also changed an area that has been something that's been very particular. You've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect on this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, FDA moved to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We don't not going to protect it just because it's political for some folks. People should know
hiding the
side
truth from
effects
the
on this
women.
drug, and there should be reporting.
Yes, against everything we believe in this country. that patients or doctors should not be reporting adverse events.
Right.
We need to know what adverse events are. We need to understand the safety of every drug, mifepristone, and every other drug. And President Trump has made it clear to me that one of the things, he is not taking a position yet on mifepristone, detailed position, but he's made it clear to me that he wants me to look at safety issues. And I'll ask NIH and FDA to do that.
Thank you.
What an
Senator White-
insane policy not to tell anybody
Thank you,
about
Chairman.
the harm of the
Mr. Kennedy, I only have 5 minutes with you.
White
so-
House,
And I've got a lot of,
who's part of a racist club
experience
that
with
only allows
PMS.
white people in the house.
so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to
5-minute
hear
lecture from this
a
dude.
clear and trustworthy recantation of what you have said
Wrong.
on vaccinations,
Wrong.
including a promise from you never to say vaccines aren't medically safe when they in fact are,
These guys are shills
and
for these jets.
making indisputably
It's pathetic.
clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep.
You're allowed to ask questions about this.
We've just had a measles case in Rhode Island, the first since 2010.
Did it come from your house?
And frankly, you frighten people. 2, I want to air harms that Rhode Island has experienced from a senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care.
Yes, Granny.
If she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies.
I know.
Inhumane and stupid.
Yes.
Granny's home dying and the family's exhausted.
Granny's home
And the
dying
respite
because
care
Bobby.
benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital.
Because Bobby did it.
Respite. It's all expensive, frightening, inhumane, and stupid.
This is Rhode Island
But the
Senator.
insensate CMS bureaucracy takes a court order to be awakened to the harm they cause.
This is cowardly.
I have
Ask him
had
a question. Ask him a question.
CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out.
Pathetic.
You're welcome to respond in writing. I ask unanimous consent that the order
Pathetic. What a coward.
declaring
Ask him
CMS's
questions.
actions
Are you too scared that he's going to
constitute
respond and obliterate
irreparable
you?
and illegal harm be put into
What a waste.
the record.
Rhode Island,
Without objection.
you have a racist senator.
Respond. I'm an implacable enemy of tyrannical, sensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health Plan, and it is a template for what we ought to be doing as a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately,
That
Mr.
can be
Chairman,
reproduced.
one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.